The active part of dying can take up to 3 days. We call it active dying, 1 to 3 days. What's happening at the very end when a patient is actually getting very close to their death? Well, remember that we all generally, statistically, die from dehydration. So there's less fluid in the body for the kidneys to make sure that the blood levels are being cleaned and that they're kept at normal values. And I'm talking about what we call electrolytes: sodium, potassium, chloride, calcium, those things. If they aren't kept at a very careful level, then guess what? There's no electricity in the body. And what do we need electricity for? Because that's how our muscles work. And if we don't have any electricity, it's like a battery operated toy, or the battery runs down and the muscles cannot work. So what happens? You probably will see that the breathing is going to really change. It gets very erratic because and eventually the little intercostal muscles that pull our chest apart, the bellows and the diaphragm, they can't really work anymore because there's no electricity to get them to work. And so the first thing that happens is that the breathing stops. Well, the heart doesn't know that, so it's just beating along for a couple of minutes until it finally can't do anymore, because guess what? It hasn't received any oxygenated blood and glucose. So the heart will stop next a couple of minutes later. And the brain, which is always the last to be protected, generally then does not get anything that it needs in the last couple minutes. That's generally the order of how we die at the very end. Breathing stops, heart stops, and then the brain dies. It's one of the reasons we tell you, please talk to your patients and let them know that you love them right up until the end, even as they're actively dying, because the brain is always preserved to the very end. It's also why, if you've ever taken a CPR class, you hear that it takes a full 4 to 5 minutes for complete death. That's because it's sequential. So don't be afraid of it. This is in our DNA. Our body knows how to do this, and it's a very usually gentle and peaceful process. Thanks for asking these questions on YouTube, and don't hesitate to ask as many as you have. I love to address them on our videos. Get our booklet. We have a couple of pages in here about those last couple weeks, transition and active dying, that are really important. Brenda and I really believe in our mission, and our motto is care is treatment.